Hey guys, welcome to our Live at 5 here at Valencia Medical Center. I'm Dr. Abraham, and thanks for joining us. We're going to be talking about any topic you guys want, but I think today's focus is going to be on MiraDry.
Yes, MiraDry.
Okay, perfect. So we're going to be addressing MiraDry. If you guys are familiar with MiraDry, you know what a great treatment it is. If you're not familiar with it, MiraDry is a treatment that we use for underarm sweating. So, for the armpits, it's an area that a lot of people have issues with. We all know that sweating in that area can be very bothersome with the odor, the actual sweating. If you experience that problem, so there's a great solution for that, and that's really where MiraDry is. So I know we've just like usual, we have some questions already. We like to combine the questions by topic, so we kind of put all the questions that were related to MiraDry together, and then we're going to be going through some of them. But if you guys have any questions, you can always also ask us, and we'd be happy to answer them over here. So MiraDry.
For MiraDry. All right, so one of the questions is, what is the procedure like? So what do you do when you first start the procedure? How does it work?
Perfect. And so we have Bianca here. I don't think you guys can see her, but she's going to be reading some of the questions. So the first question was, what's the procedure like? So basically, for most people, we usually do a consultation initially, and we kind of explain all that stuff for you, make sure you're a good candidate for it. So that's usually the first step. But if you do, decide to go through with it, if you are a good candidate, the procedure is pretty simple. You lay there, we numb the area. So usually the numbing, like most things, the numbing is sometimes the worst part, and then once we numb you the actual procedure, you don't really feel much. So we start by numbing. We do add a good amount of numbing of lidocaine mixed with normal saline under the in the area in the armpit, and then we bring the machine, and then the machine basically sends the thermal waves which kill the sweat glands in that area, and it's done. It does take like maybe an hour altogether for the treatment between the numbing and the actual procedure. But yeah, and then there's really not much of a downtime with that. I mean, there might be some swelling and discomfort in the area, but you can get back to your normal activities after.
So really during the procedure, there's not a whole lot of pain. Like you would say that maybe the pain would be kind of the initial injection of lidocaine, and then it goes away, or is there any?
Exactly, yes. Usually, there's a little bit of discomfort, with the initial injection of lidocaine. And if you've had anything where you've had, lidocaine injected, even sometimes we do for, aesthetic procedures, you can see that's a little bit of discomfort can be associated there. And then because it's a large volume, it kind of like swells up, so the area feels full. But, after that, really, it's a little bit of heat, that you might feel here and there from the machine. But honestly, most people, it just, again, the numbing might be a little bit uncomfortable, but the rest of it is very, very easy and straightforward.
Is there any downtime after the procedure?
So there isn't, it depends on what you mean by downtime. In terms of like any, excessive downtime where you have to go and like lay in bed or anything, then the answer is no, there's no downtime that way. You can get back to your everyday activities, as we said. Maybe avoid things that can make you sweat a lot, like exercise for the rest of the day, if anything. But you can get back to your normal activities as usual. There's really not much of a downtime. You can expect some swelling in the area, so it might be again a little bit uncomfortable. It's not going to be painful after the procedure, just like kind of like a little heavy, a little bit a little bit swollen, and that can take a few days, even a week to completely resolve. But it's not something that really is going to stop people from doing much on its own, to be honest.
How long, if a patient comes in and gets this procedure, how long can they expect this to last?
One of the great things about MiraDry is that the results are pretty much permanent. The sweat glands, once they're killed and they're dead and they no longer exist, they're not going to come back. So the results you get with MiraDry, it's not something that you have to keep doing like every 4 months or every year or even every 10 years. once you get the results you want, you can kind of expect that these results are going to stay with you for a long time.
Okay, so being that, you know, it's not multiple treatments, what is an average person, you know, how many treatments would an average person expect to get?
Yeah, so most people either do one treatment or maybe two treatments. So, you know, for example, like someone might come in, do the first treatment, and then they can expect something like, let's say, 80% reduction, you know, 75-80% reduction in the sweat in the area and the odor in the area. And so a lot of people are happy there and they stop there, and some people are like, you know, I want to get everything, I want to get a little bit more, so they might do a second treatment. So for most people it's going to be a one-time treatment or maybe a two-time treatment if anything. But again, that's just to kind of get rid of as much sweat as possible, and then, you know, whatever results you get with each treatment, you kind of get to keep. So.
Okay, is there any other areas on the body that a patient can do MiraDry? Like hands and feet or?
No, for now it's just used for the underarms, for armpits. So there are other treatment options for these areas. Like sometimes you'd use Botox, you know, if the conservative therapy has failed.
Mm-hmm.
So there are options for there, but if we're talking strictly about MiraDry, then we tend to stick to the armpits only.
Okay, we did have somebody ask what the cost of that would be.
Yeah, that one, that, you know, I know we always run a special, especially for people who are on these labs and stuff. So it's something that you can, you know, send us a message, send us a DM, and I'm sure they'll get back to you, you know, or you can call us and they'll get back to you and they'll give you that information.
Okay, that looks like most of the questions that I have. Is there any that are popping up on?
No, I know somebody had sort of inquired about Botox, so you can apply Botox to areas that sweat excessively, or?
Yeah, so Botox is also an option, you know, and there's, you know, Botox is right for some patients too. The kind of downside to Botox is that it doesn't last, you know, permanently, so that's why we like to do MiraDry whenever possible for the armpits. But the areas where you can't do MiraDry, like, you know, the hands, the feet, then Botox can be used for that, and Botox can help. You know, a lot of times we think of Botox for aesthetics and for wrinkles, and it's great for that. But there are other other things that Botox does, and eliminating sweat and odor is one of them. So we definitely can use it. We can use it for if someone doesn't want to do it, doesn't want to do MiraDry in the armpits, or they want to try Botox first. They can do Botox in the armpit too, as well as hands and feet. Obviously, Botox has other uses too, like migraines and, you know, some of the other stuff.
Oh yeah, the jaw. Right.
Yeah, then, you know, I know someone had also asked about the jawline, and yes, you can use Botox for that. You can use filler depending on, they do kind of different things. The Botox is for the strong masseter muscle in the jawline, so it helps relax that, and it kind of also helps smoothen the line a little bit. But if you want kind of a more defined jawline and you want to add volume and help kind of define the jawline, that would be something more for fillers, generally speaking, as opposed to Botox.
Alright.
So I think that's it. If you guys have any other questions about MiraDry, again, give us a call, come in for a consultation. There's really not much of downtime, as we've mentioned. It takes about an hour for the procedure, and you get kind of long-lasting results in terms of eliminating you know, odor and sweat underneath the armpit, and pretty safe treatment. You know, it's you know, very safe treatment compared to, you know, especially when you consider the benefits that you can get out of it. So yeah, thank you guys for joining us today, and you know, we'll see you next week. Have a good weekend.